Alright, today I'm going to teach you how to properly start an IV. A brief disclaimer, I will be starting an IV on myself, so if you're very faint to the sight of blood or needles, I suggest you not pay attention. A quick overview, we will talk about the supplies needed, how it's beneficial, and the process. Some of the supplies needed will be a Band-Aid, hand sanitizer, a sterile surface, and in my case I have a sterile drape, a needle, which I have right here, gauze, Band-Aids, and saline, which is on the end. And the reason I'm using saline and not my actual medicine is so no blood comes back, hopefully. How it's beneficial. So there are a lot of people with cancer, Crohn's disease, and hemophilia A and B. And so in my case, it's beneficial to society for people to learn, because if I were to get injured and I have my medicine on me, I might not be conscious enough to actually administer it to myself. So I would need someone else to do it to me. And now the process. What you're going to want to do is you're going to first want to clean your hands. And thanks, Lexi, I have hand sanitizer. So you want to rub that in. And then what you're going to want to do, which I already did, is undo the connection between this and then flush it through so it's all the way at the end. Then you're going to want to unwrap your Band-Aid in your gauze right here. And then you're going to want to find a vein. Now the vein I'm doing is something that's not hard for me to get because I do it every day. And so you're going to want to put the tourniquet on. And something about tourniquets is you can really lose circulation to your arm. So you're going to want to make sure that you can at least fit 2 fingers in between. Now I don't always follow that rule because I do it at 5 in the morning and sometimes I can't find veins. So then what you're going to want to do is you're going to want to put it on, tighten it, and squeeze your hand a couple times just so you get it nice and big. And I don't know if you can see, but I have hand veins in that. Then you're going to want to clean it off. And you can still stick while it's wet. It doesn't really matter. It's just alcohol. Then you're going to want to undo the cap on the needle. And you're going to want to put your arm at a 45-degree angle. You don't want to stick all the way straight down or all the way flat for the fact that you can go through the vein or just barely touch it. So what you're going to want to do is go in at a 45-degree angle like so. And then once you get it in, you're going to want to pop the tourniquet and then push some of the saline through. And you know if you made it because it won't burn. So I'm just going to push a little bit of that in. And then I put the gauze right on top of the needle, and then I pull out. And that's just how you do it. Then you put a Band-Aid on it. That's how you start an IV.